Welcome to the annual summit for the Fit for Work Coalition here in Brussels. This year our theme is investing in healthcare, breaking down the silos. In the UK there's about 35 million days lost each year because of musculoskeletal conditions, and that sort of pattern is echoed across most EU member states.
The European region, the European continent, the European Union main problem is the burden of non-communicable disease. The musculoskeletal disorder, low back pain and neck pain are actually among the ones who increased. And this is another important consideration which just indicates the area for which we need to invest more in the future.
Already today, if you average by European citizen the number of years of disability, we're talking about 18 years of disability, which in fact count, I think, for 9 billion if you translate that at European level. So clearly we need to have a sense of urgency.
When you have a disease that lasts 25 years, which is rheumatoid arthritis, you have a very long period of disability and cost. And if you can prevent one rheumatoid patient becoming chronic, that actually is a saving of about nearly €500,000. If you treat shoulder pain in the first few weeks, it very, very rarely becomes chronic. These things just are not done because they're not priorities.
Of the 15,000 work-related disorders in Spain in 2012, 80% were made up by a musculoskeletal disorder, or MSD. We need to have early intervention, yes, but we need to be supported by all the different ministries.
From the Treasury point of view at home, this is not value for money. So many people have a natural recovery period. The question is, how many weeks into symptoms should you be seeing someone? If we want a national government-paid system at home, unless we can find much, much better, stronger evidence, they do not want to pay for things that will naturally get better of their own accord. Musculoskeletal symptoms come within that boundary.
A very significant proportion of the EU workforce will have a long-term or chronic health condition over the next 20 years that will affect their productivity. My question is, are we just going to wait for them all to get ill so we can make them better or keep them functional at massive cost? Or are we going to take more joined-up, coordinated, cross-government action with a preventative focus and seeing healthcare as an investment?
We still certainly have to fight against some perception around prevention or early intervention being not cost-effective and being quite expensive nowadays. And I think the fact that we've got hard data now is really a fact that should give us confidence to go towards that route.
I will use the word again, early intervention. By whatever means in your own countries, this has to happen. It's crucial.
It's very exciting to be here. I mean, this is a great moment. It's a tradition to organize Fit for Work, where many stakeholders, experts from many fields get together with one common objective to increase and elevate the standard of care.
We have to raise the political profile of this important disease area. It's forgotten, or not recognised, that musculoskeletal conditions account for 30% of disability in Europe.
Musculoskeletal conditions are one of the biggest causes of work-related sickness absence across Europe, and things are going to get worse, so we need to do different things now to prevent longer-term problems storing up.
RMDs are treatable, important, and are going to increase in importance with the ageing population.